My name is Dr. Benjamin Anyanwu. I'm the Chief Medical Director of Region Stroke Neuroscience Hospital. I originally trained here in Nigeria before going to the United States, where I did subspecialty training in neurology and then did additional fellowship in vascular neurology and neurosurgical critical care. The reason why we started Region Stroke Neuroscience Hospital is because as a Nigerian visiting home over the several years from the United States, I noticed one thing. There are a lot of talents here in Nigeria, a lot of very well talented and well educated doctors, but unfortunately for most of them they don't have the tools to work with. The idea of establishing Region Stroke Neuroscience Hospital is to have one center where you have highly qualified doctors who are exposed, who have good training, and who have also subspecialty training and experience in using the right equipment that aid in diagnosis of patients' illnesses. Because we know that if you have the right diagnosis, then the treatment becomes much easier for you. At Region Stroke Neuroscience Hospital, we have a combination of talents and the right diagnostic equipment. We put this together in partnership with other highly trained and specialized doctors, both here in Nigeria and also people trained in UK and the United States. The idea behind starting Region Stroke Neuroscience Hospital started probably about 10 years prior to us being able to lay the foundation of this hospital. Precisely in 2007, I and a few of my colleagues traveled to Canada, Toronto, Canada, to sit down with a few other Nigerian specialists who practice in that country. We talked about how we can be able to change the landscape of healthcare in Nigeria. Yes, I know a lot of people wonder why the 10 years gone. It took 10 years because number one, we needed to raise the necessary funds. Number two, we needed to make sure that we got together a team of dedicated professionals. Some of them were in training over the years. And also to be able to figure out how we can be able to assemble the best partners here in Nigeria. Regions in 2018 eventually took off, precisely July 2018. And within that time, we've seen an enormous growth in the hospital. We do have a section for outpatients where we take care of patients with various neurological and neurosurgical disorders. We also take care of patients with what we call comorbidities for these conditions, such as diabetes, hypertension, kidney disease, hypercholesteremia. Our major areas of practice include stroke, epilepsy, Parkinson's disease, variety of neurological problems. In addition, also, one of our strengths is in neurosurgical practice. We do take care of patients who have spinal cord problems, like in spinal cord injuries, back pain, brain tumors, and also patients who present with intracerebral hemorrhage as a result of stroke. We have 3 neurosurgeons who have partnered with us. We have a full-time in-house neurosurgeon who works with us 24/7. We have another part-time neurosurgeon who we call upon if we have more difficult cases to handle. And then our lead neurosurgeon is actually US trained and travels down to Nigeria from time to time to also be able to join the ones who we have in Nigeria to ensure that we have better outcome in our neurosurgical cases. There's also a section for neurorehabilitation. In neurorehabilitation, we take care of patients with neurological and neurosurgical disorders who require rehabilitation to be able to recover. We have well-trained physiotherapists, what is called in the United States physical therapists, and also occupational therapists. We can be able to offer language and speech programs if needed as well for our patients. We have our section for electrodiagnostic technology, which partners directly with the epilepsy program. We have a section for neuromuscular disorders and also a section for vascular and echocardiography. The idea behind establishing Region Stroke and Neuroscience Hospital, like I said before, is to offer a one-stop place where we can provide excellent care in neurology and neurosurgical disorders. However, we recognize that we cannot be able to be everywhere. The idea behind coming to Mburichi in Imo State is to be able to be in a place where we can offer care in the whole region, covering probably about 60 million people in this whole region. Our impact in the community is not just providing care for patients who come from outside the region, but also in helping with community development. This we have done very, very well. We do offer occasionally, about every 3 to 4 months, free health care for our patients and for our host community. We have patients, interestingly, that come from not just within this community, but also outside this community for those free health care. We have people who come from Akwa Ibom, we have people who come from Onitsha, we have people who come as far away as Benue State to enjoy some of the free services that we offer from time to time. We have also partnered with great programs and benefactors in the United States, like the ROW Foundation, ROW. The ROW Foundation provides free medications for patients with epilepsy, while regions provide free neurological consultation for these patients. These services occur once every month and is completely free of charge for patients who cannot afford their medication and who have epilepsy. The other service we offer here is that we recognize that also in trying to provide an alternative for healthcare tourism and discourage our people from going abroad, there are certainly people you cannot stop. Also, there are people who have also started their treatment abroad, say in the United States, because their children are there. Regions provides them a place where they can come back to and continue the exact same treatment they were receiving abroad. So whether you had a surgery, say in India or in Dubai, you can come here and continue your rehabilitation. You can also come here and see neurosurgeons who clearly understand what may have been done for you in those countries and who can follow you up. So that it's not every time that you require care that you have to fly out again for follow-up. Same thing happens with patients who have had strokes. They can come here and receive state-of-the-art neurorehabilitation that will help get them better quicker. Again, remember, the key strength we have here is that we have partnered with excellent locally trained physicians who work in great teaching hospitals and great hospitals in Nigeria. We also have excellent, well-trained doctors who have trained, and some of them still practice in UK and the United States. So if you talk about a melting pot for excellent care, Region Stroke and Neuroscience Hospital is where you want to go to. You can summarize our mission and vision into one motto, which is excellent people providing excellent services for patients with neurological and neurosurgical disorders. Thank you for visiting our website, regionsneuro.com. I'm hoping that by going through our website, you'll have a rich experience of what we provide, what we stand for, and the future of the hospital.